Then they come with abortion. Abortion are waiting. Abortion are leave. Not killing. Not killing.
Then people here end up calling on the President Julius Madabio not for grief for signing the Safe Motherhood and Reproductive Healthcare Bill, where they say they before member of parliament they now for Radio Democracy. You know, Kabia the reports.
The program Good Morning Salon continues. Still inside the studios, we get the Minister of Health, Dr. Austin Dembi, who can give updates about the Safe Motherhood and Reproductive Health Care Bill. Good morning once more. Welcome to Radio Democracy, sir.
Good morning, Osman. Good morning to you, listeners.
All right. Firstly, start for tell listeners or give a background about the Safe Motherhood and Reproductive Health Care Bill.
Again, I'm really quite sad why the people that they call this Well Belay Bill. Because this is not a Well Belay Bill. This is not Cobra Bill. This is not a bill where they look at the health of the mother. Now they could call it a Safe Motherhood Bill. This country also, we now one of the countries where the whole world they admire. In fact, 3 weeks ago, the one whole Ministry of Health of Liberia, including the minister, the deputy minister, all of them directorate at Nenkayaso. About 3 or 4 weeks ago, the leadership of Burkina Faso and Kaya, at the same time, Botswana Ministry of Health are ready for Kayaso, for Kasi, which we did so. We don't make dramatic progress now. So this country in 2017, I mean, the country with the highest maternal mortality in the world, with 1,300 maternal deaths per 100,000 live births. It means that every year, 70,000 women and they die. This country have been the one country where they say all man they feed for Gebele. We don't change that. We don't reduce the maternal mortality as the fastest drop in the world. We don't reduce them by over 60%. Right now, we get a situation where about 14 to 20% of the deaths then they occur in teenagers. In teenagers, mostly because then they try for terminate the pregnancy themselves. As we talk today, right now as how we talk, you worry about patient confidentiality, but I will tell you, right now, one major family, they mourn the death of their daughter. We're now shining beam of the future with a non-loss. So this bill you will get now a comprehensive bill where they look at safe motherhood. You look at the bill from the standpoint of prevention first. Let me prevent unwanted pregnancies. So you look at education, you look at commodities, then availability, accessibility, affordability, then distribution, guidance around prevention. At the same time, every pregnancy mandatory. We do everything we can for nurture that pregnancy day, all the way to labor and delivery.
Okay.
And ensure we get effective labor and delivery. And after the delivery, make sure we get post-delivery care. Now that the bill there for. The one area where everybody they go on to. Now this one area where every day people in the try for terminate them pregnancy by themselves. And what's happening in that case, then they go, they rupture them womb, then do all kind toxic thing to themselves. By the time they come to hospital, now they die when they come. Either they die or the baby die or they all two die. What in this bill they say, in the exceptional circumstances then, let me get an opportunity for safe termination of pregnancy. And we don't work with the Interreligious Council. We don't get consultations over the past 5 years. I'm really quite surprised with Pastor Kelly Pujong. Maybe not, we don't get engaged yet. But again, this is not a lively debate. We want input. The original bill called for termination of pregnancies as needed. Yeah. But the Religious Council don't come back and say, hey, we get sensibilities. We get sensitivities where we're very, very particular about. What's in we don't do now for engage with them, say, what's in that sensitivity as? So we go capture that and improve the bill. And there are 5 major areas of import. First, they say, we don't want to let this termination just be general. We say, great, whose area them we are concerned about? They say, well, look, we get areas where we can offer termination if it danger to the woman itself, if the woman would die. For example, what's called ectopic pregnancy, where the baby for normally grown at the womb. If you're not grown at the womb, it they kill the mommy, it they kill the pikin. For terminate the pregnancy, if you not terminate and the baby go die, the woman go die. In the case of incest, waiting for do. In the case of rape, waiting for do. In case of when the baby not formed properly, waiting for do. Where they put the woman in life at risk. So we say we they accommodate all the issue then they and improve on the bill. So for just to let the people not vote for the bill, let them not again that is not fair, that is not right. Let we carry on this exchange so we'll go get input from them.
When you start, you mentioned say this bill not to puel belle bill.
Yes.
But secondly, you mentioned say this not safe termination. What's not the difference between safe termination and puel belle?
So puel belle now where you get the belle, you say, I don't want them. You just go no more at random, go say, just remove this belle for me. Well, again, the law not the law get now from 1800s. Yeah, no law not the way they allow that for happen. So you go to hospital and say, no, we can't help you. So what people then they do? Then they go BN, go take all kind medicine, go impact some appalling processes in the way they do for themselves for terminate the pregnancy.
Okay, the quick one before we go further, let me clarify certain areas and we just don't make mention of for the benefits of our listeners and perhaps we not get to knowledge. Any situation there before this bill come into play or it go pass na parliament, any law the way given the permission of medical doctors for terminating pregnancy in a situation where the mama not feel safe or the pikin safe no go.
Well, again, the law within are from 1800s.
A law the way they give them the permission.
We very ambiguous.
But they give permission for medical people.
They give permission for medical termination. Yeah, but not ancient law.
So what's different now from that one then this one is for
because what's happen now, we want to upgrade and modernize the law. Because what's happen right now, this law has to know the advocate. We know they go big for the people and go terminate them pregnancy. We know they do that. In fact, now the opposite. We want to let people and keep them pregnancy. But what's happen now is when people then go now hospital, for example, in the example working in I've been in Shagwema Hospital and Nixon Hospital for 10 years, 30 years ago. When people then go there, the mission, they say, no, we can't do this. If they're against the culture, against the principle. Then they begin and say, okay, well, wait no more, where they go? 1 week later, then will do all kinds of things to them body, then they cannot on a stretcher. Then they cannot, that's in you get post-abortion care where you authorize for them. Well, post-abortion care in that case, it don't too late. Something they don't rupture the uterus. Something they don't cause permanent damage to themselves. If they survive it, then they get complications for the rest of their life. So the thing this law they do now for modernize that and say, look, we're not the advocate for termination. But in certain circumstances where you need for, it better let you do it safely than you not do it safely. Because if you not do it safely, the consequence is quite appalling. Either you die, or you and the pikin die, or you cause permanent damage. Now, that they exist today.
Right.
And the law will try for improve on that. The law, not to abortion law, not to say that all man, anybody we want for go terminate. We don't say, in with discussions with the Interreligious Council, we say, what's now not concern them? They don't show we 5 of them concern them. And we don't make sure, say, we amend the bill. We make suggestions for amendment of the bill for reflect them concerningly. As I begin mention, number 1, then say, if the pregnancy go, they at the risk of the woman in life, then we get safe termination.
Okay.
If it be say the pikin where they form, you know get head, you know get brain, you know get abdomen, you know get all kind of vitals. If you born until they go die in the next few hours, then you can terminate. If it be say you get rape, incest, and forceful penetration, where you get police evidence for, and so we can terminate. So we don't absorb all them kind of concern. The next thing they say, oh, this is not gay before bring gay business kind of say, well, this is not safe motherhood. Okay. Who's saying gay business? Because we put the word gender inside it and say, oh, no, concerned about. So, okay, well, we'll agree with that. We remove that completely from the bill.
With regard to what you just mentioned, too, there's a particular part of the bill which I don't get off hand right now, but there is a section the way say, my body, my right.
Yes.
So, what's that one they mean? So, because many people on them misunderstood.
Yeah,
Perhaps
yeah.
say
So
this
again,
means in LGBTQ.
no, not LGBTQ business. What happened? I mean, waiting they try for. In fact, one of the concern them what they try for address and say, waiting at the right of the woman for in pregnancy. And the concern from the religious folks and the cultural folks now, waiting at the husband in right in marriage situation. So what would they say? Well, look, now we don't amend the bill for say, if you get a marriage situation, you get forget actual consultation between the man and the woman as to what they need for do. What you mean happen in the absence of this, you they force the woman for deliver, when you don't get one picking, they even wait till the picking on suckle done, you get another pregnancy, and so somebody they force them for do things. And they say, nobody know me no one is pregnant, so I don't know what you feel like. Yeah. So it's important for Lord to get woman then right, for let them express how then they feel. And for factor that and they see themselves get right. So now a conversation between husband and wife in this case, follow move forward. In another case where, for example, in the case of incest, the daddy impregnate in daughter. So now we say the daddy forget influence for say waiting for happen or waiting not for happen. Again, the picking self get right, the woman self get right. So again, I think so we try for enforce that in the bill. But if they annoy sensibilities, we ready for adjust them. Because the principle one say, now say the woman self get right. The woman right get for be factored in. The woman not to commodity for the man for the time in waiting for the waiting not for do. Again, our partnership. So we they adjust the language of the bill besides just the woman right, or say in a marriage situation, right. They also need for consult for an end product where everybody will be happy with.
So what about in case we are in the man and the woman not seems for see one side?
Well, again, now that make counseling a major part of this effort. If you read the bill, like I said, the bill now 360, counseling now an important component of all of this. We did talk, what do we want? I know, no make I can sing now so today because what do you want? Yeah. What do you want? Now for let them baby are them born safely. Yesterday, I've been in on a companion radio station. I explained to them. I said, the midwife, every day, then they sing, oh, I want to be a midwife. Oh, I want to be a midwife. Oh, I want to be a midwife. There is something I want to do. I want to catch more babies. I want to catch more babies. Oh, I want to catch more babies. This is something I want to do. So every day we mission now for let them born safely.
All right.
But if problem there, we whole effort now for counsel, for support. But in extreme cases, we all that fail. The woman said get right. We get for protect that. I think I in our try for it.
All right, Mr. Minister, it's Alex after I will get for Gona studio because you look a fine voice this morning.
For seeing the singer, yeah. And they reflect the metro.
All right, okay. When you talk about safe termination, the concern again where they come out from the public get for do it if the facility day for do some of them processes there.
Well, Osman, I don't in the bill for. If right now we don't get complete facilities, but if this bill is in place, it could empower we for building institutions, for build a regulatory framework around that, for build the staffing complement, for build the equipment and supplies, and make sure say we deliver safely. In the absence of this, we just the wing them. In the absence of this, if somebody come and not get facility, then they go try for do them by themselves. And then they see the consequences.
So listening to you now, perhaps the question going to play plenty people in mind how this bill will bring them facility and the money they waste on time perhaps after the bill go on pass na parliament, the money go just then more kickstart them for facility and they go spend the money back.
No, I think say the government get commitment to this government, yeah. I mean, one of the things that again, I don't know, we just underestimate what's not happening at this country. This country, we now shining example for waiting for women's health and women's rights in general. What's happening at this country right now? It's revolutionary. And for let be able for support, the government willing for put resources behind them, but without the regulatory framework, without the law for support them, Again, we just the wing and no more. We dey go no more every day. Again, if you don't get this framework, you're able to raise internal resources, you raise external resources, you're able to provide this service here. Because again, you know what you want to do in this country? We want zero preventable maternal deaths. Okay. Zero preventable infant deaths. Now, that's what we go for. Right now, everybody, they clap for it by the reduction we don't do. But we're not satisfied with that. Salon person not satisfied until every Bella woman get assurance say it will deliver safely for himself and in baby.
Right.
And if we need for terminate in exceptional circumstances, we do it safely so that we save the mama as well.
Before we go for break, Mr. Minister, implementation of some of the bill we Parliament can pass now, it can get a lot of issue. For example, we get the tobacco and nicotine, act we don't in existence. One concern we civil society they raise get for do it the setup of the council. So if Parliament they pass law, the implementation a problem, and the Tobacco Act now another one, then one can add again into the reproductive healthcare bill. You not think say go too much?
That's my line. I think you say you could chew gum and walk. We do all of the above. In fact, yesterday now we executive meeting. I mean, the number one thing now they are waiting for do about this tobacco bill. In fact, over the weekend, we did a team with His Excellency and one of my colleague minister to say, we're waiting, because some people let me sit down in some location, they talk, they say, well, we're waiting for this tobacco bill. Again, that bill we don't pass. Now we do look at effective implementation. We look for resources from government. We look for resources from partners. Again, a comprehensive approach. The board and the council, the board chair go help you for accelerate this, because it's in. No, deviate from this main.
Yeah, because not just an example. Because if now governments defend money for implementer, then the safe motherhood bill, safe one can had. That's not my question.
But continue they happen at the same time. Again, the importance of the tobacco bill now. Nearly every chronic disease associated with tobacco, from high blood pressure to diabetes to cancer, all the things associated with tobacco. So we did look for the resources, we defend the resources for able for actively implement, and because Parliament don't do their own side, now we own side for implement. But we don't say, hey, let's stop that one day, let's do reproductive health first. Oh, don't then we go do child health. No, we do all of the above. Even when we not get resources.
Okay, Mr. Minister, continue for those the program as to goes to do so we can take this commercial break. We'll come to continue the discussion.
We often generator they give serious problem. Paddy, of any generator shop or generator supplier will go able to get good quality generator for bio rent.
My sister, the only solution to your problem now integrated power control solution. We don't they do generator business for over 20 years now the country, and then they come with quality generator there for sale and for rent from the UK with the original spare parts, control panel of different type, and the industrial connection cable. IPCS gets good quality air conditioner with inverter where they use solar and also easy for use. With IPC, you not get nothing for worry but power business. Elect how big the factory be, you house, your business place, your office. IPC ready for give you 24 hours electrical, either by solar or generating plan. For no more but IPCS, go number 2 Moriton Road, Freetown, or you can call in at the number there 033 618 619 076 618 619 088 618 619. IPCS, meeting your power needs.
Sarah water don't come for you. It's not water we good for you. It clean and be up for you. Sarah water.
You don't hear you waiting. Sarah water don't come with.
Sarah water? What's it, ma?
Now they don't get the most advanced and best food lab na the country.
So true. But Kate, wait to advanced lab. Na Salonia. Kate, they explain fine.
Then lab they test any batch of water where they produce. Then they make sure say every drop clean and pure before they put their water na the market.
Look where they call it back. Anyway, this don't make I trust them more. And now I can talk am with me full chest. Say na them water no more get this kind high standard for me.
Me I know say once na Sierra water I dey drink and they give me family, me at it cold because I know say na the best water na the country. For more information, call 077 600 000. Pan quality, we na the best.
The program Good Morning Salon, they continue. Inside the program, we continue for look at more issues go side. The Chief Minister, Dr. David Senga, say inside 2025, government will begin for give performance contact to local council, university, and other government institutions. After we they look inside the performance contract, we they belong to ministry, department, and agency. Then we talk this inside one media engagement as we for update the public what success. Then we government don't make inside 2024. For Mondays to join Jaffa Mans Davis as he puts this report together.
2024, according to government, have been termed for delivery, and as the country just completes this year, a clear now say now. Plenty people still struggle for understand how different government initiatives like Feed Salon and other policy development implementation are able to impact the day-to-day life of citizens there, particularly with things like exchange rate and the price of different things at the market. Because of them concern here, we make the Chief Minister, Dr. David Senge, as well for proof say government able for deliver on things we will help for reduce the triangleness of the country and self-support the economic growth. Engage the media for talk to salon people, but some of the success them what government make inside 2024.
The government bring a lot of DFIs, direct financial investment. Investment in industry expand in this country. Yeah. We open cement factory, a rod factory, we open other factory there. But most importantly, a commitment of over $1 billion kind of salon last year. MCC na grant because of the great relationship with America. Good governance. And to private sector, not to government and the game. DFC alone, Salon are the biggest recipient per capita per population, over $1 billion to Sierra Leone. Forex stabilized. The Forex is stabilized, state development partner, they call me, they say, wait till you so zero. Why make it so stabilized as Salon?
Human Capital Development Initiative. Now one thing where government since 2018 done the push for, as well for empower the country and population so that they go able for do more development. And the education sector, now one key important driver for this initiative. So the Chief Minister continue for explain how this sector improved inside 2024.
Seen anything happen inside one day. 3 weeks ago, now we get this report which shows say na Salon, the Education Outcomes Fund innovation with Salon launch. The results, they say the outcome, the learning outcome, independence, also government one. The independent learning outcome from their school and the hundreds of schools. It better pass the best performing African country in school in learning outcome inside 1 year, by more than 1 year.
With that achievement there inside 2024 from government, the discussion will later change inside the engagement with the media to waiting. Then at the government in plan for 2025, and the Chief Minister, before his statement, described the government in work for this new year as a year of bold action. So let me listen to some of the bold move them. What is government plan for do inside this year?
One better relationship between ministry there and government. We know they are because we feel entitled. They are because we get a responsibility to that. Waiting we say we do before the one. If we not the one, we have to tell we who sign and we sign on do. And we say we be bold enough to say, yeah, we'll be told to do this, but we will reach there. So the performance contracts don't come back to that. Even though we have to independently go and see, but we do our own report and with evidence that we make it available. And then this year we do as well another annual performance contract for the ministry there, and the time now we one with local councils, throughout the universities.
As price formula don't help for steady the fuel price in the country, make the Chief Minister, Dr. David Senge, talk about government in plan for use this formula for help control price of different things in the country.
We see we don't get pricing formula for us. We have to get pricing formula for other essential commodities. We do it because President, you care for the ordinary man. And we not just grab, we do this too. Last year, we launched the consumer protection. That commission, they advocate for we and we give them responsibility for it. So we put the groundwork in place so that what we then in there, then we follow up and do what we need for protect the consumers, me and you. Because if me orange network bad, it always knows that we don't bow. If we bad, then we always suffer. So we all are consumer then. And so for this year, we need to make sure, say, the accountability to citizens is great. Let me get going with the civic engagement to accountability.
The Chief Minister and for call on the public and other stakeholders them for build mindset. We go help for make the country able for develop and give solution to plenty problem them where they affect poor people in different community them. For the Society for Radio Democracy, Jaffa Mans Davis, they report.
Welcome back to the program. Good morning, sir. Come to you from the Society for Radio Democracy 98.1 FM. Inside the program today, we get to tweet the Minister of Health, Dr. Austin Demby. Then at the program, they talk about waiting now the ministry position on the safe motherhood and reproductive health care bill. You don't talk much, but waiting so far the progress they don't make sense. We Parliament, we don't ask them for go and consult. Then at the program, we continue with the discussion so far. I can't again, Mr. Minister. Earlier on the program, we don't talk about the progress so far. I don't make as a result of some amendment. Then I don't propose for make to the bill way after we Parliament we don't have to go back and consult. Well, he talked about one thing very important. He said after this bill also come into play, so many facilities in the Canada hospitals and we go enhance safe reproductive health care so far. But again, the question where somebody could ask why we wait, why would they wait till a bill come to reality before ever we do things as a nation we will make the hospital be safe for people?
No. I think so. Wait till they look for not to the bill go make improvement kinds, we get a deliberate effort for improved quality of care. Again, we get several domains around quality of care. First, for example, just for obstetric care, we get what's called basic obstetric care services, BMOC. We get several of them. We get comprehensive obstetric care unit. We're in a high level care. We get quite a few of them. So what you want to do, want continue for expand Nandi and make sure, say, access to them no require much. For example, each and every district get about 2 or 3 CMOC, the comprehensive care, then get about 10, 15 BMOCs, the basic care. We want expand Nandi and make sure, say, it's available, it's accessible. So none of us say the bill will make we start the process. You get an ongoing process. In fact, a lot of the successes that we'll get now as a result of the safe delivery also revolve around them BMOC and CMOC, basic care and comprehensive care. We'll get one just for consolidating.
After the proposed amendment so far, when I don't make to religious body them so far, we want to for do with so now only terminate in a situation where the mama they on an unsafe situation or the picking self no go turn out for be a good some no go get all the parts them we supposed forget all instance whether one they mean rape or papa fall and picking so to speak. This already they are already terminate when the situation also only occur. But again, why paying so much attention into making this billing come to reality rather than focusing on the key issues that the hospital, water, light, now common problem, ambulances and the way perhaps not in certain hospitals and we go on this country. I take a report we health alert do something back. We said and found out say certain government hospitals themselves ambulance. Why not they pay attention to most of them common issues and the rather than
Channel. Not down there we therefore. Yeah, you'll be surprised for noticing that this country, we get about 1,600 facilities, healthcare facilities. We want by 2030 for expand them to 2,000 facilities. Right now, 85% of the population get access to a mental health facility within a 5-kilometer radius. We want for expand that and shorten the distance even more. Which you to look at, we don't create one of the greatest access where you can find anywhere in the region. Which you to work on now for bring quality to that access.
What's not access?
We
the access we talk about.
Where you get facility within a 5-kilometer radius. Now that is the basic standard. Yeah. Now 85% of the population get a facility within a 5-kilometer radius. We want for expand Nandi. But what's in happen now? We get access now one thing. The next thing behind access now quality. So what we talk about, we get 4 domains of quality. One, infrastructure. So you see right now, we get about 230 of them facility don't transition from thermal energy to solar energy. We will look at rebuilding the facility themselves, then physical infrastructure, the safety, give them a lick of paint. Second, We look at staffing and staffing complement. We don't increase the number of nurses and midwives who they train. We improve the quality of their training. We improve on the complexity of the services that we offer. At the same time, we shift to patient-centered care, so that the nurses then get empathy and able to work with the community within serve. We look at supply chain. First thing, once a quarter, then they get supply. Now every quarter, so once a year, then they get supply. Now every quarter, then they supply the free quality healthcare. At the same time, with the complementer, with public-private partnership, with drugs and facilities where you go able for bring the private sector inside for supplement within government they do, and we get drugs as well now, all of the facilities. So now work in progress. Then kind dramatic reduction we they see in maternal mortality, not by accident. Now by then so what they do systematically. So now allow me to tell somebody something and what they do we're visible to all man. Something anyway invisible. That systems building, we're not visible to all man, 90 responsible for that kind of dramatic drop here on IC. So.
All right. According to religious leaders, them about 9 term or 8 term, government don't rename past and present government. But still the religious leader get issue with this bill. Most of them they are against them. What's the problem? They will make you think say the religious leader up till now they are against this bill.
Well, again, I tell you, this na secular country, and I really like the kind of exchange where they go on with the Interreligious Council, because what they say is then get sensibilities, then get some concerns within they raise around the bill. They all don't say this not good bill because not comprehensive bill, but then get some concerns around some aspects of the bill. Like what I say, this bill focus on prevention, focus on nurturing pregnancy, focus on delivery, focus on post-delivery, and a small component that look at termination. Now that's how they didn't get concerned. So the exchange we'll get with them now, what's not then concern, and then raise 5 important concerns. One, as I say, now when you go able for terminate the pregnancy, we're not agreed, but they don't put them proposal forward, we don't consider, we don't make the amendments. The second, now what's not the role of consent, would I need for give permission, for example, to minors, Again, the initial say any adults, but now we don't say no, somebody will get parental authority. Now go able for give consent for minors. They say we doctor them, really perform termination. If you don't agree for them, they get penalties in the old bill. Now they say they're concerned about that. Now we don't remove that. Say it they up to the doctor. If you don't want to, if you go against the moral conscience, he allowed for not for dua. So all in concern here with the non-raise, we don't include that as amendments to the bill for then consideration. Again, if we agree on the fundamental principle, say woman not for die, pambele woman business, then again we get common side for work from. What side the differences in there? We they accommodate, and again, I don't want to say throw away all the bill, just we don't want this bill, Again, right. If you don't want this bill, that means say you say anybody who want die, they die.
Okay.
All them picking away again, you don't know, Osman, you don't know how much o'clock then they call me 2 o'clock in the morning, say, you have one ambulance, until one time. Why we for they do that when we get a preventable solution? When we get a safe solution available to we.
Okay.
So again, within this bill they do now for provide all of this for we, and we they make sure so we absorb and listen to and incorporate all of them concerns, but Lord not to away a good bill because we not read them.
Okay.
Because we not see the comprehensive nature of them.
Continue for the with me inside the program. In name now Dr. Austin Demi, Minister of Health, as we there for talk about the reproductive health care bill. We presently get a lot of issues, concern with religious leaders and ordinary people they raise about this particular bill. We'll go for a break. When we come, we continue for look at the issues we get to do with this bill.
Salon Commercial Bank don't come with new banking products them for make life easy. With Million Online Bank and Million Mobile app, you can able for use Salon Link money transfer for send money to anybody. It let you not get bank account. Transfer or receive money now the same bank or any other bank. Transfer money to person or office. It let you not get the account number. Buy Edsalite pay other bill them, and now get advanced salary. You don't need for worry again, but almost money then you earn. Because you can able for pay for things the way you buy in a supermarket and other shop them with the quick response code payment. Your pardon done. For the boss man there. Back.
No TB, Union Trust Bank, the game changer don't come. As we the lead, others they follow. And just with your mobile phone, you will transfer and receive money with ease, speed, and safety. UTB don't make it possible for collect money na ATM machine without the ATM card. Now that we call cardless ATM. You, the UTB customer, will send money to anybody and deposit and collect the money na any UTB ATM panel without any ATM card. All it can do now for just enter the reference code and collect the money. The UTB copper in safe day. With this UTB copper, any UTB customer can transfer copper with a mobile phone to anybody up to 5 million loans. And with the reference code, the person can go to any UTB branch and collect the copper. Union Trust Bank, we there for you.
The program Good Morning Salon, they continue inside the program. We continue for look at more issues we get for do with this bill. And now we go to the president for the Pentecostal Fellowship Salon, Bishop Akintayo Sam Jolly, say if Parliament pass the Safe Motherhood and Reproductive Healthcare Bill into law, that's going to make more women them die in the country. Bishop Akintayo Sam Jolly talked this in our interview with the Democracy for sake of our engagement with the all for talk about them position on this bill. They talk more to reporter Master Swari inside this interview.
Consider that you go and call that thing called ectopic pregnancy. We owe them to say this one, the baby not get hope. Okay, so that is not be considered. So we also qualify that particular point that not be taken out of context. That we say in the event we notice until we're able to prevent. Okay, that is that risky. So if I case with they don't know the woman in history, in medical history, say this woman, if you go to full-term pregnancy, then in life will be endangered. Then for don't do what they call it now, CS, okay, for remove the picking alive from about 7 months. And you get all kind of development now with technology and with medical science. So people go leave, the mama go leave. Then for which till the last crisis moment, then say one get for go. So that now with qualification of what would they say, even want to say in terms of when the mama in life they at risk.
So which are some of the provisions them in the bill we want to get issued with?
Law begin from this medical part, for example. Okay, the thing about doctors then that they say get the right to life, right to all the rights when they try to forgive. That if their conscience and their faith, their religion say I'm not for do abortion, they're not for in any way be penalized or be required for refer the patient by law, okay, to somebody else. Then this thing where the subtle approach, you see, they say law not for be ambiguous. Law not for conceal, not for hide things. So in this bill, then carefully try to push abortion as a human right. Abortion is not a human right. It's not accepted globally and not be pushed as that. Also, there's a subtle thing they don't try firstly in different ways for introduce LGBTQIA, which does continue to expand. Lesbianism, gay, transgender, and all this queer and all that into it. Okay, now, and even though they say no, don't pull this. But again, there are many more concealed. As you read through the statements, you find this phrase, this one, other status. Now, don't talk about male, don't talk about woman. Those are the other status. And then it repeated. So you get phrases like this, reproductive health, okay, and reproductive healthcare services. Now, that phrase includes abortion. So they will say they don't pull this come out, but it's still hide under that. So if you don't know, let's say, oh, okay, now let's say woman well, but the business. Issues them about consensus, okay, that is the woman gets right for go well, but in husband or no. Now, then don't tweak it and they for say, okay, the man gets right for firearm, okay, and then he can be involved in decision making. But the way when you look at it carefully, it actually shows that the husband still not get a right for say to wife say not do abortion. Then we all age 7, age 9, whatever that means, you get a right for going for contraceptives. So these are just a few of the multiple things that we hide inside this bill. We will disrupt life, disrupt religion, disrupt tradition, disrupt culture, and it cause many more damage.
What's going to be the religious and society implication if government pass this bill?
We will get promiscuity, that is uncontrolled, filthy sexual living. Okay, get misconduct with sexual behavior, and it will be rampant in the nation because Oma no say let's go well better. Okay, we will get homes divided. We will get people drop out of school. We will get them to bring in facilities from other we will not get, because right now government not get the structure for even give the women proper health care. Okay, you go to the report where the Minister of Health, okay, Dr. Dembi, give on maternal mortality issues. Okay, now when you go to the report, we say make it clear that the main thing the cause money for die are because of what's not available, including trained staff. Okay, so when you go this now, women will die more because we still not get trained staff, and with other countries, with obstetricians and gynecologists do them, they can't in the hands of what they call well-trained or people for trained. I mean, this is going to be devastating. It will get a lot of financial implication. Governments don't get the money for finances, so we'll be for bringing other institutions who can establish abortion facilities them across the country, and then they go spread them, we just kill picking them, and then use them parts them possibly, okay, for making money as they happen at some other places them, all right, and so it will bring a cost upon the nation, okay, and then the counseling sessions them with all these loopholes them, you can be sure say women will be coerced and be misinformed, because already as it is, there's a whole of misinformation going on at this stage.
All right, so if government pass this bill into law, we think will be in a position.
If you talk about position, the position will change. If you talk about response, we go look into that response.
All right, so waiting next formula on this bill.
As it is right now, we still engage with the legislative committee and those on government side where they push the bill, and we are troubled by the misinformation where they go out deliberate. These are the dangers because people are being kept back from understanding what's in the issue right now. We want the nation to know what's inside this bill.
Which message we send out there to government and other stakeholders regarding this bill?
Now people vote them into office represents the people, okay, and some position for look at what's good for the people. We believe there's a lot of international pressure. We believe that bribe we don't go around different places. Okay, and so government for look past those pressures and for investigate whether or not there's bribery. We don't go into different people then for make them not stand in time of put government under pressure. Would they say that His Excellency the President, when in Oman they look to, they got put in the seat for examine carefully with position papers there and go through details who don't provide this and then do what's right for the people of the land, not for the pockets of anyone, or for police and international body, but do well for the people of the country.
The program Good Morning Salon, they continue. Still inside the studios, we get the Minister of Health, Dr. Austin Dembi. You don't get interview. I just listened to an interview from one of the religious leader them. We had the president for the Pentecostal Fellowship, Salon Bishop Akintayo Sam Jolly. Usami the explain reporter Mastan Soare about the implication if government finally pass this bill. One get for do with pressure from international community. Is it true?
I get tremendous respect for Bishop Sam Jolly, and I don't know how kind of public and say negative things about but in this particular case, I think say correct. I mean, wouldn't the international body we care about Oman and Taiwan and this country pass we sole reason for being, as I don't say multiple times, now for save life. And I really, maybe one aspect of the bishop in statement where I really agree with, he get concerns. He don't raise the concern. He gets several of the concern where he don't raise. For example, the one where he say, doctor them for work based on their conscience. We don't agree with that. We don't incorporate that as an amendment to the bill. The one where he say, issues about marital consent and involvement. We don't agree. We don't incorporate them in the bill. The thing about special circumstances where you get challenges to the health of the mother. We don't agree. We don't incorporate them in we amendment to the bill. So again, I think it's important for the public realize the initial reaction not to the original bill But again, it will finally the Interreligious Council also just look at the amendments based on their input. This issue of gay rights or for increased LGBT engagement in that, this has nothing to do with that. What happened, the language of the original bill say gender in a very generic form. If Dandy insulting or against religious sensibilities, we remove them. We don't remove Dandy from the language. So we not hide anything inside. Again, I want a genuine engagement with the Interreligious Council because honestly, we all get the same ambition. This bill with all of the amendments, we do not add into making an even better bill, make an even stronger bill, because it factor in all of their concerns.
If you deny the allegations really come up from the man of God, say this not get up, international interference or whatsoever pressure with the government they face, why now after this government take about 6 years in power? I want able to arrive at this point now. Say, we take this bill, a low drafted bill like this.
You know what I've been on top of at the outset. At the outset, again, we focus on maternal health. We don't get tremendous success in reducing maternal mortality. Yeah, no doubt about that. Even the church group, everybody agrees. Say we don't make tremendous progress. The one area we don't left now, we cannot ignore. The one area now where they contribute the highest to maternal mortality, now this particular group of people that where they terminate the pregnancy themselves. We do not get the competencies, they not get the ability, they not get the skills. So this law, now they ask for increase in that, in termination of pregnancy. They say go low, all go terminate pregnancy.
What about the lack of facility in our government hospital? There is some term will be seen on social media outside Bele Woman in one particular village. They put an amok, yes, for good facility. That one they tell you how challenging it is for access facility. Not only for access the facility, not only for
we
access
get
the facility.
5 ambulances available
For the entire Falaba district.
For the small Falaba, the smallest district in the country. You got 5 ambulances available. You get a network of services. But you know it's not that particular case. You know what happened? Then get pregnancy. Access the services until the 11th hour. Until the 11th hour. What should they do now? Would they change the engagement around pregnancy around now? So because again, right now, would they look for register every pregnancy? Pregnancy not to labor and delivery no more. Pregnancy now before antenatal care, labor and delivery, and post-delivery. So would they change the attitude the way you say, the only way they pay attention are labor and delivery. Again, what's going to happen when we get complex cases there? Would they alert early? We do not say if you get twins, if you get triplets, if you get quads, what you deal with, not to normal pregnancy. We make sure say we know of that in advance. We then move you closer to the obstetric care. We then make sure say you link them to an OBGYN. We're not just a regular nurse go able to take care of. We did build that kind of system there. Again, I think say Salon. I need for see what go on.
All right, Mr. Minister, before we go for a break, concern we come out from religious leader them get for do it. Say una one rampant way for Puel Bele. Secondly, you are aware say most of the religious leaders don't begin preach against this bill, not part 3, section 9.2, but now the whole bill that they preach about, they call on them and then people make them they against this bill.
Again, that's unfortunate. That unfortunate because again, we the hope say we religious leader and not sensible leaders, we religious leader and not caring leader, we religious leader and not thoughtful leaders. Again, not to for just take random decision making because somebody say this now Puel Bele bill, then we go begin preach against them. Important that you know the whole issue around this bill and understand them. And I think it's our responsibility for engage. Me the hope say Bishop Sam Jolly and the other colleague them Narame will work at that level for let them able for really understand the issues, let them share their concerns, then we incorporate their concerns then and make a stronger and better bill.
You disappoint in some of the religious leaders that we don't start for preaching at the pulpit.
Again, I'm disappointed at that, but again, I think it's our responsibility for work with them, for let we make sure they then get the facts. And basically the preaching when they do it based on facts. It's not based on emotions. It's based on facts. And I think they account and respect the traditional leaders and the religious leaders and say they're not reasonable people. Yeah. And I think that if we're able for sit down and get this dialogue, you know, we'll say my own way or no way, because again, this is not a theocracy, a secular state. We get for listen to all parts. Then get for listen to research, get for listen to them. We define common ground.
Okay.
Again, I think it's unfortunate. If we said be non beats gone now, go begin talk, but always in there and begin argue and begin insult other people, then values, you know, go fair. Okay. And they expect say the religious leader themselves, they will get that same kind of sensibility, say we all care for the same thing. This bill no go cause random promiscuity. You know, there's no aspect of it. What would they say? You get a problem now. You get a problem, what would they try for solve? You know, they create new problems. You get a problem, what would they try for solve? If we not solve this problem now, we know we'll get to that point where we'll say we get zero preventable deaths.
Okay.
We'll get increased preventable deaths. What would they see right now? And this now not to my own problem, not to your own problem. Now we all problem.
Okay.
Because every day we nieces them, we
Right.
nephew them, we auntie them, we mama and they die of this. That's why they say right now, one family there, a big family, we're grieved, we're bereaved because of this year, because they not get services.
Okay. Continue for the way to inside the program, Mr. Minister. We'll go for a short break. When we can, we start for look at messages because we get a lot of messages now on the Democracy Facebook page. Lucky do be going. And the song titled Little Heroes. The program now Good Morning Salon where they come to you live from Radio Democracy 98.1 FM. And now they're gonna status Usai according to President Julius Madabio in government to make sure say this 2025 then get going to the country healthcare service. We go make sure say no belle woman no afraid for born na salon. President Bio talk this way they talk to the nation about government in different activity them. You know Kabia gets more in Gona reports.
President Julius Madabio inside in New Year message been talk about seeing the way he say in government be able for do inside 2024. Talk about the challenge them and self been talk about in government in plan for this year. As he say this year na year of action for in government. We make in say in government go make sure say in deliver plenty for the team where in be promise salon people. President Bio been first talk about the plan them. Where in say in government gets for the environment, as in say people don't do plenty bad things into this environment.
As a government, we will work decisively to mitigate the threats of climate change and adapt to our evolving realities. Our environment is a treasure that we must protect. From combating deforestation to investing in renewable energy, Cyredium will contribute to addressing the global climate crisis. We owe it to future generations to safeguard our lands, waters, and biodiversity. We will review and update Cyredium's nationally determined contributions and develop a comprehensive strategic plan for climate change for 2025-2030. We will also strengthen our collaboration with our national and international partners to mobilize climate financing to support climate-related economic development activities.
In carry on for talk about the gain them, where in government don't make na the education sector and safe, how in plan for improve inside 2025.
Fellow Cyredians, we have made great strides in improving access to education and are recognized globally for our strides in advancing foundational learning. This year, we will double down on quality education, reaffirming our commitment to providing a solid foundation for our nation's future. We will invest more in equipping our teachers, modernizing our schools, and integrating technology into our classrooms. With renewed zest, our youth, the heartbeat of our nation, will find more pathways to education, skills training, and entrepreneurship. We will continue to strengthen the legal and regulatory framework to foster the enabling environment for creating jobs in agriculture, manufacturing, mining, fisheries, tourism, construction, entrepreneurship, and the service sector. We are determined to ensure that every Sierra Leonean has a chance to contribute meaningfully to our shared prosperity.
Now, this the president been get for say to Salon people for sake of the rule of law and good governance.
My government will continue to uphold the Constitution by protecting the rights of every citizen and building a nation where unity, freedom, and justice prevail for every Sierra Leonean. In the spirit of unity, let us remember that our diversity is our strength. Tribal, regional, or political differences must never divide us. As a people, we must work together, respect one another, and hold firm to peace and democracy. Good governance is the bedrock of development. In this new year, my government will continue to uphold transparency, fight corruption, and ensure that public resources benefit all Sierra Leoneans. We will continue to strengthen our institutions and deepen our democracy. However, all these will remain in the realm of imagination if we do not lay a solid foundation backed by data for implementing these noble plans.
President Julius Madabio inside this in New Year message be make commitments say in government go make sure say they're not denying any picking the rights for leave by way I will say then go put different facility them at different hospital them.
No mother should fear giving birth, and no child should be denied the chance to thrive. This year, we will expand access to healthcare services, strengthen our healthcare systems, and continue to prioritize maternal and child health.
President Julius Madabio end up say in government go make sure say then give more strength to the well body sector na the country. For Radio Democracy, Kabia the reports.
The program they listen to now, Good Morning Saturday, they come to you from the Society for Radio Democracy 98.1 FM. Tonight the program will get the Minister of Health, Dr. Austin Demby. Then the program they talk about within the position on the Safe Motherhood and Reproductive Health Care Bill. Inside the program, we don't talk on the progress, we don't make the engagement they don't make so far with religious body them and within the hope for this particular bill. But inside the program, we continue with the discussion, but we go studio too quick and take that the work about and we'll come back with the continue with the minister.
Another morning again, I say when the man, I say when that I say fumble, I say this new auditor general report, I say it beats 10 man, I say then say the cannabis people them, I say the cannabis they body them we pack na VP office and they now the one that say then they body outside them come more central tank in some Tissue Road, Shakila Road, or with Bafors or even Lombribo, who's one and then cemetery had them come out. Then say then go down. The 10 no more way than they pay, 9 then get appear. I say, don't they lost back like na Nigeria film. I say, I say now go 9-4 so then say the office day. I say them point and liar point and more. He say the office day. Then they forge no good no bad. Now then can say Uncle Koto, himself, na ghost na them packing in office man. They know they see them but the couple they move. I say, unu no sabi Koto na big businessman man. I didn't tell me she didn't say what about culture chef as he touching the diamond so that diamond the Nastoni stands. I say Tawala, I say money no Tawala, why you do? Now the money over there. I say they not they tell big man for come on, you know. I say you been don't start fine. I say I you start a fine so I say end fine. Because what me no understand. And that's something they would doubt me. I say first of all, I say bo Uncle Tawala been the look that 2022 audit report. I say all of a sudden I say he not even care and go to recommendation as well. I say don't go back to 2023. I say I say bo nakambale go reverse gear bo. I say so you remember say the health people and get plenty motokade. I say where they need clarification for. I say na the battle be stop for. I say one no. I say one no. I say nobody not be confused with abortion bill. I say them motokade one no. Talking about abortion bill. I say this abortion bill. I say in the no. I say he make religious leader then they bind and cash. I say then they swear people there now, and that's where they can swear now into the first, second, third, and fourth generation. That's now you put on the. I say why are you that's where they now say? I say that don't collect. I say left to you. I say that back quiet. Then just swear generation as well. But if you want you can collect too. But again, some of them got their back. Where then they make so pure. Some of them. Now we no more Bible talk say judge not. I no go judge, but some of them back. Then self, if you look fine, then they expand the belly, then business with the pueblo. I say Pambul, I say. Then say from 2 weeks now, then say man away, aka no one the ark, no one the boat. I say she don't know the for anti-map, not the for I say 9 first now they go to office, 9 last they come out. I say all time where they pass now the old phone. I say just they watch the boat. What you do them people yeah? Me, I don't ever work about.
Welcome back to the program. Good morning, Salon. Inside the program, we continue to engage with studio guests, but we take some of the text messages you don't kind of the program also get plenty in the inbox, both now with Facebook page and self now with text line on this number 077-981-981. We start for take some of the text message, then we'll go say this first person who I go taking text message, they say there is no safe abortion. Your bill just give up. I check that one day again, Mustafa Bayon, they say there's no safe abortion. Your bill will just give the unqualified medical guys space to do more abortion and get rich by killing innocent children. God will not please with you people.
This one from Jibril Kanu, we say, Mr. Minister, why is the government waiting for the bill to be passed before building the facilities? Why not building and improving the facilities before passing the bill?
This other person, winner Victor Fodi, they say, Mr. Minister, is there any month bracket for the termination of the pregnancy?
And this other one say,
month bracket for the termination of the pregnancy.
And this other one say, what are some of the categories of people that should be okay, this one not too clear.
Okay, this other person on Facebook page, they say abortion. I mean, are you aware of the abortion of the death penalty? He said no more death penalty, and he wants people to kill people.
You saw the one from Justice Saloni say, if we are really genuine as a country, I do not think the bill will be an issue. Already there is a lot happening behind closed door because we do not have the necessary structures to address most of the deaths, which many of our young girls and women are faced with. So I think this bill is here to address and improve safe space and address the health of women. So the bill is not bad at all.
This other person, they say this bill is not good for our nation. There are many things to address in this country instead.
This one from Lolo is say, I personally do not support abortion under normal circumstances because of religion. However, we do not always know the situation or how pregnancy came about. I think it should be an option available for women.
This other post, they say legalizing abortion divert attention from more pressing issues that could benefit society economically and morally. Why not channel this same energy into creating better health facilities, education system, and economic opportunities, addressing the root cause of unwanted pregnancy, such as poverty, lack of education, and inadequate access to contraception, will be more constructive approach.
This other one from Ishmael is say, na water in light unanoye bugi na government hospital them. Then on one pass bill we go make woman the pull belly safe one. Okay, yeah.
This other person, this is Sayalo needs to address its abortion laws. Illegality of abortion does not reduce the rate of abortion. It only increases women exposure to unsafe practice. We have to protect them. Love means making decisions together and living with the consequences together.
This one say, Mr. Minister, waiting being una sipa this bill we make una de BNM. A come out from Mohammed na Kambia.
This other person, they say, I beg to disagree. People are already benefiting by doing abortions illegally. It is in fact a solution to unsafe practice. If your moral values are against abortion, then you have a right to do it. What you are being stripped of is the discretion as to who should or should not get abortion. Most times people who are vehemently against this issue have had to do it themselves. The only difference is they were not judged.
This other one from Mystic Nadwazaki say, I think your ministry should do proper consultation. This bill have brought mixed feeling among Sierra Leoneans.
Usman, I think for time that one didn't I'm your inbox now. I'll go for take now.
The last one I will take from Martin and New England. Say, Mr. Minister, what assurance are you giving the public that abortion will be accepted in tremendous circumstances, including when the life of the mother is at risk, in instance of rape and incest, and the instant? Okay, these are not too clear, Mr. Minister. These are some of the messages that we'll get inside the program this morning.
Just great input from the public. And again, as we see this in our listening government, we put forward an initial proposal and up for debate and consultation. And all of the answers with the non-raised now valid, important issues where in a lot of cases we don't incorporate in the revised version. So again, the revised version, we don't present this to the Interreligious Council for let them see them and weighing on them, and we they wait for a reback from them, and then we will continue with consultation in public as well as with Parliament. But all in here we don't say really important, valid issues. Again, the main bones of contention with or without this bill, people then they terminate pregnancies. Unfortunately, then they terminate pregnancy in a very unregulated fashion, where they result in high mortality, where they result in complications, where they punish people then for the rest of their life. Waiting this bill they do now for bring sanity to the process. They increase the number of abortions, and they make sure say, if and when abortion is required or termination of pregnancy is required, that it is done safely. What do you mean by safety? Again, if you not get this kind of environment for terminate the pregnancy safely, as in the case of incest, rape, or whatever, when the woman in health at risk, you get a situation where people and they do all kinds of practice. All kinds of practice, and they go to quack them or themselves, they take all kind of medication where they result in, if they not die, then and then baby go die. Now down now what they deal with. How to solve that problem? Again, the people in our church, they know they see this every day. The people in our mosque, they know they see this every day. We will sit down at studio, so we know they see this every day. But we in the hospital, we they see this every day. Now, big problem. So what you they try for do now for create some laws, we go bring guidance, we go bring regulation, we go bring structure and make sure say if we need for terminate the pregnancy in special circumstances, and do it safely so that the mother will come out okay. Now that this law they're all about. Again, we're not going to satisfy if we not get a situation where the mommy is safe. Yeah. And again, all of the concerns that we then give, for example, Bishop Sam Jolibin say the biggest concern is that the doctor them, punish the doctor that if they don't want to do it. Well, we don't incorporate that. They say, oh no, this is not gay business. Now no one bring come by Saje, by Koni. Absolutely not. We put gender inside it as a generic term, but if that gender they insult people, we don't remove them from the bill. They say marital consent, marital input. We don't say initially. We say the right of the woman. That one they will not go walk away from. The right of the woman is still important, but we say consultation with spouses as an integral part of the family to ensure within decision as they get made.
Any engagements with tribal aid mandem?
Well, we don't do. Over the past 5 years, again, which you don't see now, where the bill on go to Parliament, a culmination of a lot of consultations over the past 5 years.
Them in position.
Yeah. Again, them position in a lot of cases now, which you see reflected in the religious council. Again, we try to incorporate all of the concerning. They start with a perfect bill at the outset. You start with a bill based on your consult and your ideas and the circumstances. The consultation they help you for improve the quality of the bill. So what's me worried about now? Where people they say, "Oh, just dismiss the whole bill."
As minister,
yes.
you didn't have the country. They see the reaction of people.
Yes.
You think say this not bill where majority of Sierra Leoneans they want for see?
When people then understand the nature of this. See this bill now comprehensive women's health bill. When they understand, say this bill also they focus a lot on prevention and ensure say one belle no they get belle. That we involve education, involve commodities, make sure say you get the commodity accessible and affordable. They really know say we all process here now for ensure say if the woman get belly, let we encourage them, let we work with them, let we support them, let we make sure you get all immaculate, let we make sure say you get all in mercy, let we make sure say not to 4 antenatal clinic visit, but if we get 8 antenatal clinic visit, every time we can clinic, if you get high blood pressure, we manage them. If you get diabetes, we manage them. If you get other existing conditions, we manage them. All the way to labor and delivery, we make sure so you get skilled birth attendants, including obstetric gynecologists available for ensure safe delivery. And after delivery,
people don't know land we still.
Well, what's happy where people in Ombi say this is not poor belly bill. They know they see the rest of the bill. Okay. Now we frustrated with. Now the money because again the public need for no say this is not comprehensive bill we cover all the aspects also of the safe model, because at the end of the day, what you want now for let the woman deliver safely.
Okay.
This is not a Puel Bele bill, this is not Kumbra bill. And again, with the work with again the religious leader them in this country, then get a powerful platform. People then listen to them. And we respect that. Now make one let them get the facts at their hands, the facts at their fingertips. Not for just go by rumors or what you see. Now make the bill now just very short bill, 18 pages. If you sit down in 30, 45 minutes, you will read the whole bill and understand the entirety. Right. So again, we'll work with them and ensure, say, let them understand, say, all of them views, they get incorporated in the revised version, and we return them back to them for letting them provide input. So we get a much better bill going forward, an improved bill. Again, with the work with Parliament, not a forced Parliament, Parliament are the legislative body in the country. And they make the law, we they execute the law. But what you want to do now for provide all of the facts. So not for tell the MP then just dismiss the bill right off the bat when you not give them the facts and the contents. This now comprehensive women's health bill.
Plenty thank you for joining inside the program this morning. In name now Dr. Austin Demby, in the Minister of Health, assuming there, and we get updates about the Safe Motherhood and Reproductive Health Care Bill, where a lot of people, including religious leaders, them get concerned. But plenty thank you for joining inside the program this morning, sir.
Thank you, man.
Yes, when I good go the curtain of the program, good morning, sir. Welcome to you live from Radio Democracy 98.1 FM. Plenty thank you to producer Ademi Jackson and Kerifa to Conte. Plenty thank you to John Kamara, DJ Sugarcane, Jaffa Mantizevis, Fatmata Samura, Mekuna see you live on Facebook. So to meet another 10 minutes, Musman Kamara, have a wonderful day. Bye bye.
Your name na Chemno Jalaway. Don't forget for listening to the midday show program at 12, Salon News at 7, and waiting to be at 9 o'clock. So to meet again, get yourself a wonderful day.